Greetings, comrades. Now, COVID has not been in the headlines for some time, and indeed, with the picking up of the vaccination drive and the lockdowns and the restrictions, the numbers have come down a bit, but it is important to note that the problem is still there. And along with that is the problems of India's failing, faltering healthcare system. A symptom of this are nurses out on strike protesting, not on strike, but they're protesting against inequality of pay and conditions at work in the SSKM hospital in Kolkata. Here is the news on that. So, protest against transfer order, pay inequality. 7 nurses fall ill at the SSKM hunger strike in Kolkata. It is important to note that this issue is not new. It has been going on since at least July of this year. The Telegraph had reported this, and it involves over 3,000 nurses from the state. State government hospitals protest seeking end to pay disparity. This is an extremely important issue, and it involves frontline healthcare workers, which nurses are. And as we have seen in previous reports, India's frontline healthcare workers have to take the brunt of the pressures that come up from dealing with the COVID pandemic. Risky infraction because of the timing, more than a year into the pandemic, during which nurses played a critical role in tending to the sick, earning accolades from all quarters. Engineering diploma holder. This gets to the core of the issue. Engineering diploma holder gets a 12 pay. There's a difference of 8,000 between 9 and 12. We want to end this discrimination. Now, the government has replied with fake assurances, which ended nowhere, and for the large part, complete silence. Here we have the junior minister of health giving a statement. They have a grievance, they can raise it with the government and we'll look into it. And yeah, I cannot take any policy decision. An excuse, of course. Official private hospitals say that only 30% of nurses in Bengal were from the state, which gets to another issue. West Bengal, the state suffers from an acute shortage of nurses, which strains the healthcare services even further. That makes the job of the nurses harder, and it really makes them more important. So why the government would ignore someone of this importance is almost inconceivable, but yet here we are. Since July, and now it's November, nurses are protesting again, say pay revision, and have started a hunger strike. 2,500 nurses, the numbers keep varying, apparently. It's still quite a substantial number. Carry on relay hunger strike at the School of Nursing building at SSKM till the demands. And nurses have actually fallen sick during this hunger strike. It's a smaller example of what we were seeing in the farmers' agitation, where we have, on the one hand, a government that won't budge, that does not listen to the masses, and on the other hand, we have determined people who have mobilized to protest very legitimate grievances. Now, what we have learned from the farmers' agitation is the importance of unity, organization, and determination. That is what it would take to make the government bend, concede. The policy decision and require. The context is important. This COVID situation in India is not over. Here is the number of new cases in Bengal. And yes, it picked up after the festive season. It usually starts in the middle of September and goes up to November. We are in the middle of November now. little past the middle of November. And as you can see, after the decline of cases down to 500 or so, here it came to about 300 new cases. It has been slowly picking up and it's reached 976 on the 26th of October. Then a little dip and again back to the 800s. During the festive season, of course, as we know, we have Diwali and we have Durga Puja, and there are numerous other festivals like the Chhat Puja is there, the Jagadatri Puja is. All these pujas resulted in people forgetting the norms of social distancing, gathering in tight spaces, and the authorities being unable to control or discipline the crowds. And as a result, you see the situation of numbers rising again. And on the other side, we see nurses being put under pressure. And here we have a situation where nurses are out on protest, they're falling ill, and the government is simply not listening to them. This speaks to the larger problem of India's healthcare system, the excessively privatized healthcare system, the abysmally low spending in healthcare, the lack of facilities, the lack of medical education, and at the core of it, a lack of respect to frontline healthcare workers who were absolutely essential dealing with the pandemic. They were lifesavers, and now we have thrown them out on the streets. There is only one remedy for this, that is agitation. Unfortunate as it is, they must come down and protest to meet their legitimate grievances. We should support them wholeheartedly.